We're diving right into a complex topic today, one I'm sure you're all too familiar with.
Yeah.
The lingering effects of the COVID-19 pandemic.
Yeah.
But we're going beyond just the virus itself in this deep dive.
Right.
We're going to be looking at excess mortality across the Western world, even after the initial waves of the pandemic subsided and the vaccines were rolled out.
Exactly.
And for this, we'll be looking at a 2024 research study published in the BMJ Public Health journal.
Great source.
It analyzes data from 47 Western countries, spanning from January 2020 to December 2022.
So, a pretty comprehensive look.
Definitely.
And this study uses the term excess mortality,
Okay.
which might sound a little jargony, but it basically means
What's that mean?
it's the number of deaths from all causes that exceed what we would typically expect under normal circumstances, taking into account things like seasonal variations and long-term trends.
So not just deaths directly attributed to COVID.
Exactly. It's about the bigger picture, the overall impact on mortality. And to get this data, the researchers used the Our World in Data database.
Okay, and that draws on data from?
Really solid sources like the Human Mortality Database and the World Mortality Dataset.
So we can be fairly confident in the reliability of the data.
Absolutely.
That's good.
Yeah, and what they found was, well, pretty sobering.
What'd they find?
There were 3,098,456 excess deaths across these 47 Western countries from January 2020 to December 2022.
Wow, that's a huge number.
Yeah, it really puts the scale of this into perspective.
And it wasn't just a one-time spike either, right?
No, that's the really alarming part. In 2020, 87% of the countries studied reported excess mortality. That number increased to 89% in 2021 and 91% in 2022.
So despite mitigation efforts, the percentage of countries experiencing excess mortality actually rose each year.
Exactly, a trend that demands a closer look.
Absolutely.
The study also uses what's called a p-score, which basically tells us how much higher the observed deaths were compared to the expected deaths.
Okay, so a p-score of 10% means observed deaths were 10% higher than expected.
You got it.
Makes sense.
So in 2020, at the onset of the pandemic, the total excess deaths were 1,033,122 with a p-score of 11.4%.
And we know from research even back then that the infection fatality rate, especially for younger people, was likely lower than initially thought.
Right, but even with that knowledge and the rollout of vaccines in 2021, we saw the highest number of excess deaths, 1,256,942, with a p-score of 13.8%.
Wow.
And in 2022, with most pandemic restrictions lifted, the numbers remained high.
Still high. How high are we talking?
808,392 excess deaths and a p-score of 8.8%.
So even as we moved into a post-pandemic world, the excess mortality persisted.
It did, which raises a lot of questions.
It does.
What factors are driving this trend? Is it solely COVID, or is there something else at play?
Right, because this study doesn't give us a definitive answer, does it?
It doesn't, and the authors acknowledge that.
Okay, so what do they say?
They emphasize the need for further investigation, particularly looking at cause-specific mortality data.
To really tease apart the different factors contributing to these excess deaths.
Exactly. It's a complex puzzle, and we're still missing some pieces.
We are, and to complicate things even further, there's debate about the statistical methods used to calculate excess mortality.
Right. Some researchers argue that certain methods might underestimate the true figures, especially for 2022.
So the data we have might not even be telling the whole story.
That's a real possibility, and one that we need to keep in mind as we delve deeper into this issue.
Definitely. So where do we go from here? We know excess mortality is high, and we know there's more to the story than just COVID.
Right, so now we need to start exploring potential contributing factors. And one area that needs a closer look is the potential indirect impact of the pandemic measures themselves.
Things like lockdowns and the disruptions to healthcare systems.
Exactly. Think about the potential consequences. Delayed diagnoses, postponed surgeries, the strain on healthcare resources.
All of which could have contributed to increased mortality from other conditions, like heart disease, diabetes, even mental health issues.
Precisely. It's a reminder that the pandemic's ripple effects extend far beyond the virus itself.
And there's data to support that, right?
There is. One study in the USA found a significant increase in excess mortality attributed to non-COVID causes during the first 2 years of the pandemic.
Wow, so while we were focused on combating the virus, other health issues might have been unintentionally neglected or exacerbated.
It's a complex web of interconnected factors, making it even more challenging to pinpoint the exact causes of this persistent excess mortality.
It is, and it highlights the need for a truly comprehensive investigation, one that leaves no stone unturned.
Absolutely. We need to examine all possible contributing factors, including the potential long-term effects of vaccines, to fully understand this phenomenon and develop appropriate responses.
We do, because understanding is the first step towards finding solutions.
Couldn't agree more. It's fascinating when you dig into the specifics.
What do you mean?
Well, the study doesn't just present those big overall numbers, it also looks at how excess mortality played out in different countries.
Okay. Any interesting examples?
Yeah, take Greenland, for example.
Yeah.
The only country in the study that didn't have any excess deaths from 2020 to 2022.
Really? None at all.
Not according to this data, which suggests that maybe geographic isolation or their specific public health policies played a role in protecting their population.
That's pretty amazing. Makes you wonder what they were doing differently.
Right, and it shows that there's no one-size-fits-all explanation for these trends.
Makes sense. Each country has its own unique context.
Exactly.
So it's not just about looking at the overall numbers, but also those country-specific variations.
Exactly, and even within individual countries, excess mortality fluctuated over time.
Oh, so it wasn't a steady increase.
Not necessarily. The study shows the Peace score curves for some of the most populous Western nations.
Like which ones?
The USA, Germany, France, the UK, Italy, and Australia. And you see these peaks and valleys, highlighting how dynamic this phenomenon really is.
So in the U.S., for example, were there periods where excess mortality was particularly high?
Yeah, you see these sharp spikes in early 2020 and again in late 2020, right when those initial waves of the pandemic hit.
Okay, and what about 2022, when things were supposedly getting back to normal?
There were still periods of elevated excess mortality, although not as pronounced as in the previous years.
Interesting. So even as we transitioned out of the acute phase of the pandemic, there were still these fluctuations in excess deaths.
Exactly, and that suggests that multiple factors, beyond just the virus itself, likely contributed to those spikes.
It's like a complex interplay of different forces.
Yeah, and while the study doesn't delve into the specifics of those factors, it provides a framework for further investigation.
Encouraging us to consider both the direct and indirect effects of the pandemic.
Right, and we can't forget about the potential role of vaccination programs either.
Okay, so we've talked about the numbers, the trends over time. Now, what about the geographic distribution?
Right, so to help visualize that, the study uses a color-coded map.
Oh, a map. That's a good way to see the bigger picture.
It is, and it reveals some interesting patterns.
Like what?
Well, in 2020, the highest Peace scores, remember those measure how much higher observed deaths were compared to expected deaths?
Right.
They were concentrated in Western Europe,
Okay. Any countries in particular?
especially countries like Spain, Italy, and the UK.
Interesting. So Western Europe was hit particularly hard in that first year.
They were, but then by 2021, the pattern shifted.
How so?
Eastern European countries, places like Bulgaria, Poland, and Hungary, they started showing much higher Peace scores, while excess mortality seemed to decrease in many Western European countries.
So a geographic shift in the burden of excess mortality.
Yeah, and that suggests that whatever was driving those excess deaths was evolving over time and that different regions were being affected differently.
Fascinating how those patterns emerged.
It really highlights the complexity of this issue.
It does, and the need for region-specific analysis.
Absolutely, and the study takes it a step further, breaking down the data by categorizing those excess mortality Peace scores into different ranges.
So we can see how many countries fell into each category each year.
Precisely.
Can you give me an example?
Sure. In 2020, 21 countries, about 45% of those studied, had Peace scores between 0% and 10%.
Okay, so relatively low excess mortality.
But then in 2021, that number dropped to 18 countries, while the number of countries with Peace scores between 10% and 20% jumped from 16 to 21.
So more countries experiencing higher levels of excess mortality.
Exactly. And that trend continued in 2022, with even more countries seeing Peace scores above 10%.
Concerning trend.
It is. It underscores this issue of increasing excess mortality in many Western nations, even beyond the initial impact of the pandemic.
Reinforcing the need for deeper understanding.
Exactly.
But it's important to acknowledge that even with all this data and analysis, the study has its limitations, right?
Of course, no study is perfect, and the authors are transparent about that.
What are some of the key limitations they point out?
Well, one is the potential for incomplete death reports, because of delays in registration.
So the numbers might not be entirely accurate.
It's possible, in fact, at the time the study was published, 4 countries were still missing complete mortality data for certain periods.
So the reported excess mortality figures, especially for 2022, could be underestimates.
That's a real possibility.
Something to keep in mind.
Definitely. And they also acknowledge that the data is collected at a country level without those detailed breakdowns by age, gender, or other demographics.
So we can't really explore all the potential contributing factors as deeply as we might like.
Exactly. And then there's that ongoing debate about the statistical methods for calculating excess mortality.
Right, we talked about that earlier.
And the authors recognize that their chosen method, while being transparent and relatively simple, might not capture all the nuances of this complex issue.
So even with these limitations, the study's findings are still quite significant.
Absolutely. They're both stark and thought-provoking, forcing us to confront this reality that the pandemic's impact goes far beyond the initial health crisis.
We're still dealing with the ramifications in ways we're only beginning to understand.
It's really crucial to emphasize this point. This disturbing trend of high excess mortality sticking around even after the initial phase of the pandemic, it's something we can't just ignore.
We need to understand it, right? What's driving these numbers, and then figure out what to do about it.
Exactly. And that's where you come in, as informed listeners.
Oh, what can our listeners do?
This study used the Our World in Data database, remember? Well, that's publicly available.
So anyone can access it?
Exactly. I encourage you to go explore it yourself, look specifically at the data for your own country or region.
So dive into the details.
Yeah, see what kind of patterns you notice. Are there specific periods where excess mortality spiked in your area?
Right, and then think about what else was happening at those times. Could there be a connection?
Exactly, because this study gives us that big picture overview, but those real insights, they often come from those smaller details.
The little things that might get missed at a global level.
Exactly. So as you're looking at this data, think about the questions that come up. What don't we know yet?
Right. What additional research needs to be done?
What information is still missing? And how can we push for more transparency and accountability in addressing this whole issue?
Because this isn't just some abstract academic thing, right? This is about understanding the reality of what's happening in our society.
Exactly.
You've got to move beyond those simplified narratives and really engage with the complexity of it all.
Absolutely. The pandemic was this huge global event with far-reaching consequences.
And we're still uncovering those consequences.
We are, and understanding them, including this persistent excess mortality, is absolutely crucial for building a healthier and more resilient future.
Couldn't agree more, and this deep dive has been a real eye-opener.
Yeah, a glimpse into a complex and pretty unsettling reality.
It has, but it's just the beginning, right? The search for answers continues.
It does, and it's a search that needs all of us to be informed, engaged, and determined to uncover the truth.
That's a powerful call to action, and I hope our listeners will take it to heart.
Me too. It's time to step up, ask those tough questions, and demand answers.
Because the pandemic might be fading from the headlines, but its effects are still very much with us.
They are, and we can't afford to look away.
This has been a truly thought-provoking deep dive, and I want to thank you for joining us today and sharing your expertise.
It's been my pleasure. Always happy to contribute to these important conversations.
To our listeners, thank you for tuning in. We hope this deep dive has equipped you with the information and the motivation to engage in these crucial conversations.
Stay curious, stay informed, and stay engaged.
We'll be back soon with another deep dive into the most pressing issues of our time. Until then, take care.